In the complex landscape of mental health treatment, atypical antipsychotics have emerged as a key component in the management of schizophrenia and bipolar disorder. Two commonly prescribed medications in this class are risperidone and olanzapine. Both drugs have proven efficacy in reducing symptoms and improving overall quality of life for patients, but how do they compare? This video dives into the similarities and differences between risperidone and olanzapine, highlighting their respective mechanisms of action, dosage forms, side effects, and potential drug interactions. Understanding these aspects is crucial for healthcare professionals, as it allows for personalized treatment plans that can maximize therapeutic benefits while minimizing adverse effects. Whether you're a medical professional seeking evidence-based information or an individual navigating the complexities of mental health treatment, this video aims to provide a comprehensive overview of risperidone and olanzapine as atypical antipsychotics in the treatment of schizophrenia and bipolar disorder. Join us as we delve into the nuances of these medications, empowering you to make informed decisions in the pursuit of better mental health. Understanding schizophrenia and bipolar disorder. Schizophrenia and bipolar disorder are complex mental health conditions that significantly impact the lives of those affected. Schizophrenia is characterized by hallucinations, delusions, disorganized thinking, and a lack of motivation. On the other hand, bipolar disorder involves recurrent episodes of mania and depression, with periods of normal mood in between. Both disorders can cause significant distress and impairment in daily functioning. The treatment of schizophrenia and bipolar disorder often involves a combination of psychotherapy, lifestyle modifications, and medication. Atypical antipsychotics, including risperidone and olanzapine, play a crucial role in managing the symptoms of these conditions. These medications help to regulate neurotransmitter imbalances in the brain, reducing the severity and frequency of symptoms experienced by patients. Risperidone, mechanism of action and effectiveness in treating schizophrenia and bipolar disorder. Risperidone is an atypical antipsychotic that effectively treats both schizophrenia and bipolar disorder. Its mechanism of action involves blocking the activity of dopamine and serotonin receptors in the brain. By modulating these neurotransmitters, risperidone helps to restore the balance and reduce the symptoms associated with these mental health conditions. Studies have shown that risperidone is effective in reducing positive symptoms of schizophrenia, such as hallucinations and delusions. It also improves negative symptoms, including social withdrawal and lack of motivation. In bipolar disorder, risperidone helps to stabilize mood, reducing the frequency and severity of manic and depressive episodes. Risperidone is available in various dosage forms, including tablets, oral solution, and long-acting injectable formulations. The choice of formulation depends on the individual's preferences and treatment goals. It is important to note that risperidone may cause side effects such as weight gain, sedation, and extrapyramidal symptoms. Regular monitoring and adjustment of dosage can help manage these effects and ensure optimal treatment outcomes. Olanzapine, mechanism of action and effectiveness in treating schizophrenia and bipolar disorder. Olanzapine, another atypical antipsychotic, is widely used in the treatment of schizophrenia and bipolar disorder. It works by blocking the activity of multiple neurotransmitter receptors, including dopamine and serotonin. This mechanism of action helps to alleviate the symptoms associated with these mental health conditions. Research has shown that olanzapine is effective in reducing both positive and negative symptoms of schizophrenia. It also helps to stabilize mood in bipolar disorder, preventing manic and depressive episodes. Olanzapine is available in tablet and orally disintegrating tablet formulations, providing options for patients with different preferences and needs. While olanzapine can be highly effective in managing symptoms, it is associated with certain side effects. These may include weight gain, sedation, and metabolic changes, such as increased cholesterol and blood sugar levels. Regular monitoring and lifestyle modifications are important to minimize the long-term risks associated with these side effects. Comparing the efficacy and side effects of risperidone and olanzapine. When comparing the efficacy of risperidone and olanzapine in the treatment of schizophrenia and bipolar disorder, studies have found both medications to be similarly effective. Both drugs have been shown to reduce symptoms and improve overall quality of life for patients. However, individual responses may vary, and it is important to consider factors such as previous treatment history and coexisting medical conditions when making treatment decisions. In terms of side effects, risperidone and olanzapine share some common adverse effects, such as weight gain and sedation. However, olanzapine is more commonly associated with metabolic changes, including increased cholesterol and blood sugar levels. This can pose long-term risks for patients, necessitating regular monitoring and proactive management of these effects. Risperidone, on the other hand, may be more likely to cause extrapyramidal symptoms, such as muscle stiffness and tremors. It is crucial to weigh the benefits and risks of each medication in the context of an individual's specific needs and circumstances. Close collaboration between healthcare professionals and patients is essential to ensure the selection of the most appropriate medication and to develop a comprehensive treatment plan that addresses both symptom management and overall well-being. Factors to consider when choosing between risperidone and olanzapine. When deciding between risperidone and olanzapine, several factors should be taken into consideration. Firstly, the individual's treatment history and response to previous medications should be evaluated. If a patient has shown a positive response to one medication in the past, it may be preferable to continue with that medication rather than switching to a new one. Additionally, the potential side effects of each medication should be carefully considered. For individuals with a higher risk of metabolic changes, such as those with pre-existing diabetes or obesity, risperidone might be a more suitable choice due to its lower risk of metabolic effects compared to olanzapine. The route of administration may also be a factor to consider. Risperidone offers the option of a long-acting injectable formulation, which can improve medication adherence and reduce the risk of relapse in some patients. Olanzapine, on the other hand, provides the convenience of orally disintegrating tablets for those who have difficulty swallowing traditional tablets. Ultimately, the decision should be made collaboratively between the patient and healthcare professional, taking into account the individual's unique circumstances and treatment goals. Regular monitoring and open communication are essential to ensure the ongoing effectiveness and safety of the chosen medication. Case studies and patient experiences with risperidone and olanzapine. Understanding the real-world experiences of patients can provide valuable insights into the effectiveness and tolerability of risperidone and olanzapine. Case studies and patient testimonials can offer a glimpse into the impact these medications have on individuals' lives and help guide treatment decisions. For example, a case study might describe a patient with schizophrenia who experienced significant improvement in symptoms and quality of life after starting risperidone. The case study might highlight the challenges the patient faced prior to treatment and how risperidone helped to alleviate these difficulties. Similarly, a patient testimonial might share the experiences of an individual with bipolar disorder who found olanzapine to be a life-changing medication. The testimonial might detail the positive impact on mood stability and overall functioning, providing hope and encouragement to others facing similar challenges. These real-life stories can serve as a source of inspiration and validation for individuals seeking effective treatment options. However, it is important to remember that every individual's experience with medication can be unique, and what works for one person may not work for another. Therefore, a comprehensive assessment of each patient's needs and preferences is essential to tailor treatment plans accordingly. Potential drug interactions and precautions for risperidone and olanzapine. As with any medication, risperidone and olanzapine can interact with other drugs, potentially affecting their effectiveness or causing adverse effects. It is important for healthcare professionals to be aware of these potential interactions and take necessary precautions when prescribing these medications. Risperidone, for instance, may interact with medications that affect the activity of liver enzymes responsible for drug metabolism. This can lead to increased levels of risperidone in the body, potentially increasing the risk of side effects. Close monitoring and dosage adjustments may be necessary when combining risperidone with certain medications, such as fluoxetine or paroxetine. Similarly, olanzapine can interact with drugs that affect liver enzymes, potentially altering its metabolism and efficacy. Medications that induce or inhibit these enzymes, such as carbamazepine or fluvoxamine, may require dose adjustments or alternative treatment options. Additionally, both risperidone and olanzapine can potentiate the sedative effects of other central nervous system depressants, such as alcohol or benzodiazepines. Combining these substances can increase the risk of excessive sedation and impaired cognitive function. It is crucial for healthcare professionals to thoroughly review a patient's medication history and consider potential interactions before prescribing risperidone or olanzapine. Open communication with the patient regarding their current medications, including over-the-counter drugs and supplements, is essential to ensure safe and effective treatment. Alternative treatments for schizophrenia and bipolar disorder. While risperidone and olanzapine are effective treatments for schizophrenia and bipolar disorder, they are not the only options available. Depending on the individual's specific needs and circumstances, alternative treatments may be considered. For example, other atypical antipsychotics, such as quetiapine or aripiprazole, may be prescribed as alternatives to risperidone or olanzapine. These medications have different mechanisms of action and side effect profiles, offering additional options for patients who may not tolerate or respond well to the first-line choices. In some cases, adjunctive therapies, such as cognitive behavioral therapy or family therapy, may be recommended alongside medication to enhance treatment outcomes. These therapies can help individuals develop coping strategies, improve social functioning, and enhance overall well-being. It is important for healthcare professionals to consider the unique needs and preferences of each patient when exploring alternative treatments. Collaborative decision-making, based on open communication and shared decision-making, can help tailor treatment plans to optimize outcomes and improve the overall quality of life for individuals with schizophrenia or bipolar disorder. Conclusion: the role of risperidone and olanzapine in the treatment of schizophrenia and bipolar disorder. In conclusion, risperidone and olanzapine are valuable medications in the treatment of schizophrenia and bipolar disorder. Both drugs have proven efficacy in reducing symptoms and improving overall quality of life for patients. However, considerations such as mechanism of action, side effect profiles, and potential drug interactions should be taken into account when choosing between them. Risperidone and olanzapine offer different advantages and disadvantages, making individualized treatment plans essential. Factors such as treatment history, risk of metabolic changes, and route of administration should be carefully considered in collaboration with patients to ensure the most appropriate choice is made. Furthermore, alternative treatments and adjunctive therapies can also play a significant role in the comprehensive management of schizophrenia and bipolar disorder. A holistic approach that combines medication, therapy, and lifestyle modifications can provide individuals with the best chance of achieving symptom remission and improving overall functioning. By understanding the nuances of risperidone and olanzapine as atypical antipsychotics and considering the needs of each patient, healthcare professionals can truly empower individuals in their journey towards better mental health.